This needs to be the first video that you watch when you tear your Achilles. Choosing whether or not you want to do an Achilles surgery or go the conservative route, either way, it's going to be pretty time sensitive because if you do go the surgery route, it's almost not worth it if you do it after a few days. And if you go the conservative route, you need to get to your therapy right away for optimal results. What I'm going to be discussing in today's video is things that I personally think do not get discussed enough relating to this topic. Just a disclaimer, this is not professional or medical advice. This is me sharing my experiences as well as the information that I know is out there so that you and your healthcare team can make an informed decision on what you think is best for yourself and for your particular situation. That being said, I recognize there are people that are watching this right now with various backgrounds and different accesses to healthcare. So one of the things that I hope to do with this platform is to bridge that gap. Although I am a rehab professional, I decided to go the surgical route. But unsurprisingly, I, along with pretty much every healthcare professional, will tell you that surgery should only be when the benefits outweigh the risks. Okay, let's get this message out there cold. Some of y'all are treating surgery like it's a haircut. Americans. Yes, we are extremely fortunate to have high quality surgeons across the world who are really good at what they do. But in a culture where we can literally go from McDonald's to McDaddy if we have enough money to get the procedure done, some people view surgery as this comforting insurance policy to either make poor life choices or put so much faith in it that no matter what problem arises, a solution is just one surgery away. As a physiotherapist, I've seen patients that have come to me pre-op before they're about to get their surgery. And sometimes I'm scratching my head thinking, why are they getting surgery done for their particular situation? And don't always assume that your physio or your doc is going to be bringing these things up to you unless you ask first. See, the thing is, a lot of us healthcare professionals have learned our lesson with some of our more zealous patients, starting a healthcare war of the egos behind the scenes that some of us just stopped asking if you thought this through. It's just too much unpaid paperwork.
I just want to check, did you have the opportunity to consider the conservative option for this approach?
So we're all set for the surgery. Any other questions before we begin?
So, Doc, my physio says you have no idea what you're talking about.
Okay, let's talk about the conservative approach. There is evidence suggesting that conservative treatment for an Achilles tear can yield similar results for certain measures as going the surgical approach. Now, for the most part, the default in several countries is actually to treat the Achilles tear with the conservative approach unless you're a high-functioning, high-level athlete. Essentially, if you go the conservative route, you're going to be fitted into crutches and a boot, and different clinics will have different protocols. Now, a popular protocol, and the one that I followed as well, is weight bearing as tolerated as soon as you get into the boot and as soon as you're on the crutches. And that's actually the protocol that I personally prefer as well. I think it yields better results. In a nutshell, every few weeks, you adjust the positioning into dorsiflexion and plantar flexion. Now, dorsiflexion, think up to the door. Plantar flexion, think down to the plants. Plantar flexion is kind of what you start at. Dorsiflexion, which is going up, that's where you're going to keep increasing with. The biggest and the most obvious benefit of going the conservative route is to avoid the complications that can arise with surgery. Damage to the sural nerve, infection, etc. But something that does not get talked about enough, and something that's important to keep in mind, is the newer procedures for the Achilles repair, the more minimally invasive procedures. They have a lower rate of complications versus the older open repair procedure. Now, does this negate the complications that can arise from surgery? Of course not. Make no mistake, an infection at the site of the Achilles or nerve damage is a very troubling problem. At the same time, it should be pointed out that although the risks are there, they're relatively low. Another major reason that surgery is recommended is because it is said that the results of surgery are similar to the results you would get going the conservative route. Previously, it was accepted that re-rupture rates were lower amongst the people who went the surgical route. And more recent evidence suggests that it's actually quite equal. Like the people who went the surgical route and the people who went the conservative route, they actually had not a significant difference in the levels of re-ruptures. Recent literature is suggesting that people who go the surgical route and people who go the conservative route and implement an early accelerated rehab program actually have non-significant differences in the amount of re-ruptures seen. Return to sport levels are also said to be similar, but I want to challenge that a little, and I'm going to get to that. Another aspect of surgery to consider is you're going to be in a cast and non-weight bearing for a few weeks. Now this is harder said than done. Mine was only 2 weeks, but for some of you, depending on your surgeon's protocol, it might be more. But those 2 weeks, or however many weeks they are, those will humble you. Shout out to my little bro for setting up a mattress right next to me through the whole thing. I don't know what I would do without him. And if you have to pay out of pocket for your surgery, then money is definitely another factor that you need to be considering. Because unless you're getting your surgery done from your 8-year-old nephew, surgeries can be pricey. The first opinion I got was from a surgeon who didn't budge at all. So I hired a lawyer and I sued him for malpractice. No, I'm kidding. But I know some of y'all got really excited when you heard that. You will find several surgeons who believe the non-surgical route is the best option for many patients. I personally had my own reasons to challenge this, which I'm gonna get into. So right away, and I mean literally day 2, I drove an hour away for a second opinion for one of the best sports medicine doctors I have come across. A mentor, a colleague, a badass doc, Dr. Minhas. He's a sports medicine doctor, ringside physician for Ontario MMA and boxing, and has extensive knowledge in helping men boost their testosterone levels and optimize their male hormonal health. Click that subscribe button because you'll definitely be seeing a lot more of him soon. Then I reached out to one of the best, if not the best, foot and ankle orthopedic surgeons that I have come across. He's someone that I knew would understand my situation because he was also a former athlete. Dr. Desai. Knowing I was getting my surgery done from someone that I trust was a major decision in me choosing this route. He didn't sugarcoat anything. He told me if the surgery was going to be worth its while, I needed to come right away. So literally the next morning at 6 a.m. I was there for my surgery. Fun fact, at that time, I was his fastest surgery. I think it was around 7 minutes. Another fun fact, that's the third leg of mine that was operated efficiently under the knife. So now let's talk about going the surgical route. Now I have heard a lot of bashing on going the surgical route for this injury, but there's strong cases, in my opinion, to opt for surgery for a certain group of people. What I really want to focus on and what really bothers me from a PT's point of view is the discussion of returning to sport and returning to previous level of activities. Now studies do show that in regards to returning to activities of daily living, low-level sport, and even competitive sport, surgery versus conservative is actually pretty similar. Return to sport measures is something that needs to be seen a little bit more critically though. First thing we need to understand is not all sports are created equal. Also, it is not always clear what these studies are referring to when they describe return to sport. Some of these are self-reported, and depending on how optimistic or cynical someone is, one might consider returning to basketball as shooting threes the whole game and not playing any defense. Actually, wait, that's how Gen Z plays basketball anyways. While a more difficult person to please may consider running 0.01 seconds slower on a 100-meter dash as not returning to previous level of sport. Now, many studies when assessing return to sport, they use aspects such as range of motion and strength. However, with more high-level sports, we need to understand that there is an element of power and speed that's important too. If we analyze some of these studies, we will recognize that there is not a significant difference in the surgical versus the non-surgical groups between measures such as low-level isometric strength or range of motion. As an example, the height you can get on a heel raise, and that's great. But some studies show that people who did go the surgical route did indeed have higher levels of power output. This was ultimately a major reason I decided to opt for surgery. I mean, ball is life, and I needed to get back on the court if I was going to be discovered by the Lakers. LeBron, respond to my emails. Now, another problem to consider in these studies is a lot of these studies use different measurements of returning to sport as part of their study. I want you to understand this for a second. We have a systematic review, meta-analysis in front of us, and it's analyzing different studies that use different tests for patients, athletes to return to sport. It's hard to say that all these measurements can be contributed as equal. Now, another important thing to consider is a lot of these studies, they use different measurements when it came to return to sport. I want you to think about that for a second. If you have a systematic review and a meta-analysis that's looking at a bunch of studies in front of you, and they're not even using the same measurements of returning to sport, that can be problematic when you're comparing a surgical versus non-surgical group in returning to sport. It's also important to recognize that recent literature has scrutinized some of these return to sport measurements that these studies are using. At the moment, there is no uniform return to sport measurement for Achilles tear, which can also be problematic. This is not just in literature, this is also out in the clinical world. As an example, one common measurement PTs use to assess if someone post Achilles rupture can return to jogging or return to running is one single calf raise. Other PTs consider that extremely liberal. Relying on current research when it comes to functional return to sport outcomes, it should be taken with a grain of salt. And lastly, to address the Rerupture rates, I know I'm going to turn some heads and make some people angry with this one. Just hear me out. Let's step out of the world of black and white research for a second and put you in a clinical perspective. one thing that is really hard to include in research numbers is the psychology of injury. Now, many Achilles re-ruptures happen because of a false sense of confidence. In fact, we have something that we call the danger period in Achilles rupture recovery. And I'll talk about that more in a future episode. But essentially, the reason it is called that is because there is a period where there's a lot of re-ruptures that happen because the Achilles tendon is in a very weak biological state. But at the same time, the patient is coming out of their boot, they're starting to walk again, they feel good, they have this false sense of confidence, and they get too confident. And that's how some of these re-ruptures happen. This is both surgical and conservative, by the way. So now let's apply this concept to the psychology of surgery. From a clinical perspective, I have personally seen, as well as some of my colleagues have seen, people who go the conservative route tend to be a lot more careful when it comes to avoiding anything that can cause them a re-rupture. And that's just the reality. There are stories I have heard of patients who have gotten the surgery done thinking their Achilles is suddenly invincible. In fact, the stories, they go a little bit like this. The patient gets the surgery done, they're out of the boot, and right when they get out of the boot, despite being recommended not to, they go into intense level of sport. Or a patient might have completely forgotten that they tore their Achilles, and then they see their kid who is about to fall and they run after them. Now, does this speak for all of the Achilles re-ruptures? Of course not, but it's something to keep in mind. Now, this is something pretty interesting. There was a study that proposed another factor to consider between going the surgical or conservative route is the gap of the actual tear. They found that people that had a gap greater than 5 millimeters and went the conservative route were at more risk of re-rupture. So which is the best option? I can honestly say both approaches have really good and strong reasoning behind them, but I'm going to give a quick summary of a general few things to keep in mind. So if you go the conservative route, research does show that you can have very similar outcomes as patients who went the surgical route, especially if you implement an early accelerated rehab protocol. The lowest risk of re-ruptures were seen amongst patients who got minimally invasive Achilles repair surgery and completed an early accelerated rehab protocol. But more research is needed for that. Also, patients who have a gap of greater than 5 millimeters may be at greater risk of re-rupture if they go the conservative route versus the surgical route. But more research is definitely needed for this particular one. There is a lot of shade being thrown at the surgical approach because of black and white numbers when there is a gray area that is hard to assess. Surgical complications are an important consideration to keep in mind, but they are lower in the newer techniques versus the older open techniques. High-level sporting measurements such as power seem to support the surgical approach, but more research is needed for this as well. Current return to sport measures and protocols, they need a lot more work, and they are currently not uniform. Now, no matter what route you take, one of the most important things for you to have a positive outcome in the future is to start an early accelerated rehab protocol. Do it. And lastly, the most important aspect of making this decision is choosing a very strong medical, surgical, and rehab team. Whether you're going conservative or you're going the surgery route, your rehab game needs to be elite. I'm a physio and I went the surgical route, but the first thing I did was made sure I had my rehab team in order. Hit that subscribe button and bell notification icon to see more of them and their perspectives in future episodes. Ultimately, I have no regrets for getting surgery because I made this decision with a group of medical and rehab professionals that I trust. And I also really pondered on what factors were most important for me. I also know of many other athletes and healthcare professionals, including physios, docs, pharms, who have no regrets of going the conservative route. But whether you're going the surgery route or the conservative route, they both have a fairly similar approach to return to sport and the recovery journey itself. And I will be discussing more on future episodes, so make sure you subscribe and hit that bell notification icon. There's some great stuff to come.